But we're going to start first with Lombardo, who is an opera singer. And 10 years ago, he had to retire earlier than he had really hoped to. He retired at 65 because he could no longer manage his own meetings and attending places. He couldn't multitask, in other words. 5 years ago, he was diagnosed with early dementia. 3 years ago, he was diagnosed with quote-unquote Parkinson's disease because of some stiffness in his limbs and slowness, but he didn't really respond very strongly to the medications. And now, currently, he's having hallucinations and delusions. About 40 people live in his house, and none of them have legs. So, what does he look like? Physically, he looks like he has really mild Parkinson's syndrome, or Parkinson's disease. He walks, he talks, he's very functional, physically functional. He can even hold a conversation with you, and if you didn't know him, you wouldn't think anything was wrong. He can feed and clothe himself, do most of those activities, but he needs some supervision because of those hallucinations, delusions, and occasional forgetfulness. What does his wife look like? This one is supposed to be funny. But this is what she looks like. She's haggard and burnt out. Medicines don't seem to help him. They can be used a little bit, but they're not as strong as, say, in a garden variety Parkinson's disease patient. Memory medicines can help a little bit. And then antipsychotic medicines, medicines to treat the hallucinations and delusions. And I just want to make a little side note that there's only 2 antipsychotic medicines that are, and I'm put the word safe in quotes, but safe, in any kind of Parkinsonian syndromes. All the rest will make their Parkinsonism, their physical symptoms, much, much worse. So this becomes a very tricky situation when you're trying to treat the mental without affecting the physical. So the 2 antipsychotic medications for anyone with Parkinson's, Parkinsonism, or anything that looks like Parkinson's is quetiapine and clozapine. I put 2 big no-nos on the right in red. I don't know if they came out very clear, but there's Zyprexa and Risperdal are the brand names.